is Cece Doucette with TechSafe in Worcester, Massachusetts. We're so very grateful for everybody tuning in to learn the wireless risks and, most importantly, tech safety solutions. I want to thank our sponsors here at WCCA TV in Worcester, Massachusetts. And today I'm very honored to bring you a session with Theodora Scarato, who is the Executive Director of the Environmental Health Trust. She is a clinical psychotherapist and a mother, and she has been working on this issue for longer than I have. And Theodora, welcome so much. It's lovely to have you with us today. Can you come on in and say hello and tell us a bit about how you learned about technology risks?
Sure, I'm so glad to be here. So I learned about it over a decade ago when I was working directing an inpatient therapy program, intensive therapy program at a special education school. And I worked with a lot of kids who had had prenatal exposure to drugs. And I was doing my research and my continuing education in neurological impacts and how to treat these children, because it was really different than the other children that I had with behavioral problems from trauma and so forth. So I really got involved in the brain. And when I learned that this kind of radiation, wireless radiation, impacted the brain, I knew that nothing could be more important than really diving into it. And I did. And much like you, came out realizing that there was a wealth of research that showed harmful effects, hundreds of scientists that were speaking out on it, and yet the laws that we had were not protective. So that's how I got involved over a decade ago. And now I work with Environmental Health Trust, and we're working at the federal level and educating people about this, and also really trying to get accountability so that we have laws that are protective of people and the environment.
Well, we are so grateful for the work that you've done in all of those areas, Theodora. And it takes a lot to get in with the federal regulators and try and get this topic addressed. Can you tell us a little bit about the Environmental Health Trust versus Federal Communications lawsuit that CHD and EHT have sued over, along with others across the country?
So, Environmental Health Trust is a scientific nonprofit, and we have been working on this issue for over a decade as well, even before. One of the things that we were doing was pressuring the government to re-look at the limits. These are the limits that have to do with how much radiation can a cell tower emit into the air? How much radiation can your cell phone emit that is absorbed into your body? Wi-Fi routers, smart this, smart that, all of these things that are wireless are emitting. And there are laws that are in place related to how much and also how you test what is the level. And they are from 1996. So one of the things that Environmental Health Trust has been doing is sending to the federal government the FCC, which are followed supposedly, making sure that they have science. And we submitted just thousands of pages of evidence to them over the years. What they decided in 2019 is that they did not need to update their limits from 1996. So we sued along with other groups. And the case is Environmental Health Trust et al. Versus the FCC. You can look it up on our website and get the documents that we submitted as evidence. And what the U.S. Court of Appeals found, D.C. Circuit, to just a few months, a few years later, was that the FCC had acted in an arbitrary and capricious manner when they decided to keep their 1996 limits for wireless radiation. Basically, they hadn't fully shown that they looked at the record that was before them. And the issues that the judges raised were, you ignored and didn't clarify, how your limits are protected related to children's unique vulnerability, because they absorb the radiation deeper into their body, and as well, they are more sensitive because their brains are still developing. You didn't address the issues of long-term exposures. The FCC couldn't even come up with authorities that they had pulled from to show that their limits protected against long-term exposure. As well, non-cancer effects like impacts to memory, sperm damage, oxidative stress, and very importantly, are the non-human issues, how this wireless radiation impacts the environment, birds, bees, and trees. The court found that the FCC had completely ignored the science that was on the record related to biochemical changes in plants, damage to tree canopy from nearby cell tower antennas, and impacts to animals, our wildlife, birds, bees, pollinators. So we have the situation where we have these limits, which are supposed the laws of the land, but they are inadequate to protect us, and there's really no one watching the store. One other important thing we found in this, that the courts determined in this lawsuit is that the other agencies that you think would be protecting us, right? The CDC, the EPA, they have not adequately, some of them are not doing anything. Let's start with that. They were completely silent. And they are not even adequately looking at this issue. You would think, and this is what I thought way back when I learned about it as a social worker. I'm looking at the issue. I'm like, oh, surely the EPA, I know they're on this. They're looking into this. I actually called up the EPA and I hung on that phone for a long time. Like, well, just bring me to someone who knows anything. Guess what? They were defunded in 1996 and they haven't done a review of all of the science.
Oh,
in
goodness.
fact,
Yeah, so you say 1996, that's the year that the industry got the Telecom Act passed, and they defunded the programs where qualified scientists were doing good research. And then when that Telecom Act came in, those programs just disappeared. So you've really, yeah, go ahead.
The defunding was happening beforehand, but the full defunding happened actually a little bit earlier. And then in 1996 is when it was defunded. And at the same time, the Telecom Act, which was the most heavily lobbied bill at the time, perhaps ever in the United States, came in. So it was kind of like all together at the same time, the defunding of the EPA, the Telecom Act, and the FCC adopted industry-created standards, groups which were filled with industry and military experts, developed limits that really work for technology and making the equipment work, but were really not protective, especially of long-term effects or biological effects. So there's no other agency with health expertise that's looked at all of the science.
Oh, goodness.
It simply doesn't exist.
Yeah, you really brought to light that we have a huge regulatory gap. And you were so helpful in the study that the New Hampshire Legislative Commission did in their groundbreaking report. You helped the legislators and others learn about this issue. And during that finding, up came this report out of Harvard called Captured Agency, how the FCC is dominated by the industries it presumably regulates. And
Right.
so they included that in their report too, along with 15 recommendations to educate the public, get our federal delegates on board and have them start working with our federal agencies again to get public policy in line with the current science, and identify and label everything in the community that's radiating, so people who are walking down the street or hanging out at the curb know if they're standing right next to a cell tower or one of these new 5G small cells, which, by the way, there's nothing small about these. They've got a tremendous amount of energy pulsating at close range in the microwave spectrum. So we're very grateful for the work that you did with New Hampshire as well. I know the industry has such deep pockets and long reach. New Hampshire did this incredible report, And then when they went back to the legislature, their own legislature, to say, here's what we were commissioned to do, here's what we found, here's what we'd like to do next based on our findings. So legislators in New Hampshire have brought bills forward to start implementing setbacks, so you can't put a toxic cell tower in close range of anybody, or to form a registry so that as people are getting sick from today's man-made technologies, they can at least report it into their state, public health database. And then we did another one to try and unhinge some of the local control restrictions that were put into the law in New Hampshire. And every time we get close, darn it if the industry doesn't get in there and undo all of the good work that we've been trying to do. So I know you may be facing a similar situation at the federal level with that remand back to the FCC from your court case. And it was Friday the 13th of August in 2021 where the courts told the FCC to account for these vulnerabilities. And so where do we stand with that today?
Well, everyone asks that question. Mm-hmm. They say, well, has the court responded, right? And they have not. So it's been, 2 years, or coming on 2 years, there's been no response. They were mandated by the judges to respond specifically to the issues I talked about: children, long-term exposure, the non-cancer harms, memory, sperm damage, and so forth, and also issues of the environment, and also the issue of, should phones really be tested at a distance from the body? Like, does the way that we test this technology make sense? They have not responded. Now, go ahead. No date that the court gave to them. This is actually typical in cases like this. It is not normal for court decisions to say, here's the date you have to respond with large federal agencies. They give a lot of deference to federal agencies. They did not go to the Supreme Court to appeal, by the way. So this decision really stands, but there's been no response. And actually, it is typical in cases like these that there'll be no response. And then there is a subsequent legal action that is going to be taken as we expect, but it is not right after. This takes years and years and years because the court needs to have that. It's been a lot of years. We can't go back a few months later or a year later or even 2 years later and sue them right then and there. We could, but the way these cases go, at least in history, he has neglected to respond, and that it is egregious, which we, of course, believe.
Well, I am so grateful that you continue to do what you do and you keep this fight going. Well,
let me just tell you, we are submitting to the FCC now. If you go to the FCC filings and search Environmental Health Trust, you'll see that we have been submitting once or twice a month all of the latest science, because every week there's new studies. It's nonstop. I'm sure you've brought up Dr. Joel Moskowitz and how he's putting out some highlight studies. You can go to EMF portal. So what we're doing is putting on the record the continued research that wireless has harmful effects at levels that are below FCC limits and ICNIRP limits.
Well, thank you for your vigilance on that, Theodora. And I know that you see the harm happening in real life today. And I'm so grateful that you and your colleagues at Environmental Health Trust are also working on how to help the public. Let's not wait for the federal thing to play out, because that's going to take forever. So tell us about this new project that you guys have launched recently called Healthy Tech at Home. And I've given you screen sharing privileges, so when you have a second, if you want to go ahead and pull up your new website and walk us through that, so that today people can continue to learn. And through Massachusetts for Safe Technology, once a month, I do a free public education webinar, so anybody is welcome to go out to our website. It's MA4safetech.org, and you can go out there and just register to join us. If the times don't work for you, then just register and we'll send you the video and my slides, which will allow you to drill down into the science and other documents like the FCC and the Captured Agency report out of Harvard, and most importantly, resources to help us get to safe technology. So I see that Theodora has pulled up her Safe Technology for Our Children homepage of their website, Healthy Tech at Home Project. So Theodora, go ahead and walk us through this.
I will. So healthytechhome.org is the website. It's healthytechhome.org. And this is our Healthy Tech at Home project. So we have a lot going on here. The first page is just talking about how children are more vulnerable. And we have links to the science, which I'll show you, simple steps to minimize exposure, and just a little rundown on international laws to protect children, like in France, where they have banned cell phones being sold to young children, Cyprus, and many other countries that actually have banned Wi-Fi in kindergarten. And you can just and ways you can just sort of dabble into the issue. Then we have steps that you can take, limiting children's use, learning about airplane mode and turning antennas off, creating a sleep sanctuary to, address sleep, which is a super easy time when you can reduce your exposure and your family's exposure. We also have, and so I'll leave that to you to be able to click around, but let me just go here. Let's see if I
love that you have these graphics too that kind of show where all these radiation exposures are, because just like with the pandemic and COVID, it's an invisible toxin, and we can't really know it's there unless we get taught about it. And then measuring is really important too, because with the Internet of Things, they're looking to put antennas in every device that we buy, and oftentimes there's multiple antennas. So you could think you got them all, but until you actually measure with a radio frequency detection meter, you don't actually know for sure that you've gotten and turned off all those separate antennas.
And that's why one of the first things that we recommend is that you go around your house and identify, like, what do you have in your home that emits radiation? And getting a meter is such a great way to start that process. In fact, one of the things that we are working on at Environmental Health Trust, and our website is ehtrust.org, is getting libraries to have those meters, because we realize that they are quite expensive. But you want to get not the cheapest consumer grade meter, but more about higher level, and they're about, in the $400 or over $300.
Yeah.
But you can get your library to have it, and then everyone in the community can go to your home. Like when I got my meter for the first time, and let me tell you, it took a lot of convincing to get my husband to agree to buy the meter. That was 10 years ago. That's what changed everything. I brought it to my desk, and I was shocked that my cordless phone was emitting so much radiation. I'd already turned off the Wi-Fi router. I wasn't using my cell phone. And here I was sitting in front of the cordless phone. So you sort of learn all those sneaky sources of radiation when you get the meter. The other thing is, we do have a program so that if your library does not want to get the meter, you can contact us at Environmental Health Trust, and we will support. We have a certain amount of support that we give to meters to libraries. So please contact us.
Oh, that's fantastic. I didn't know you had that program, Theodora. I just want to show, this is the Safe and Sound Pro 2 broadband radio frequency detection meter. And it's put out by a company called Safe Living Technologies. And I don't get a kickback or anything, but this is the meter that was recommended at the EMF, or electromagnetic fields, medical conference. So doctors are also bringing this into their practice, loaning it out to their patients and having them do that scavenger hunt around the house, and then come back and the doctor will help them, learn how to remediate. So I actually got a grant from my town to put one on loan in our public library back in 2016. And now with most libraries having something called the Library of Things, it's not a stretch for them in many of their budgets to actually be able to put one of these on loan. I know out in Pittsfield, Massachusetts, they just bought one right out of the library budget. In another case in Newton, Massachusetts, a doctor and I went after a grant that was offered through their cultural council. So I too think it's very effective to have one that the entire community can borrow, because seeing is believing, and it really helps when you're opening this conversation with others to be able to show them the fine print in their own device, because then it takes it from conspiracy theory, tinfoil hat, to what do you mean it's been telling us all along not to stick it in our bras or our shirts or our yoga pants or our back pockets, as we see a doubling and quadrupling in colon and rectal cancers and so on. So yeah, having that meter is great. So go ahead, tell us about the science on your website.
Yeah, so the meter's key. And just a note, when I went to my library and just started talking to the wonderful librarians at the front desk, they were like, oh yeah, we have water meters. We have all these, they have all kinds of meters. And they were like, well, of course we can do that. I was like, okay then. So let me just show you a few things, because there's a lot of information, but it's actually pretty simple. And our goal was to simplify it so you had it. So people always ask, where's the science? We have a page on the science on Healthy Tech at Home. Little summary, and then you can click, you can see lists of studies, right? Studies on brain, studies on prenatal, on how our limits are protective and so forth. They go pretty deep, but sometimes you need information, right? And we also link to all of the studies. So it's all science-based, because I know that people will often say, well, there's no evidence. Well, there's so much evidence. Then we have what medical associations are speaking out on this and links to all of that. So you go to this page and then you can click and you can get links to letters the FCC has written. We have little videos that have been done by pediatricians. We have the Santa Clara, California Medical Association PDFs that they put out in their bulletin, which are just so important. And I'm sure you've heard of Dr. Cindy Russell and Physicians for Safe Technology. She did several articles. Each one of these you can click on, and then you can get the PDF. And these are great to download, to share in your community. And we have links to all of them. So the other thing I want to show you on the menu here is fact sheets. You can contact us at Environmental Health Trust, info@ehtrust.org. We also can send you some of these if you want to distribute these in your community. But we have fact sheets on what parents need to know, how to minimize exposure, how to hardwire your laptop, different flyers for different groups, right? We have a really simple checklist on how to reduce exposure that's black and white, so you can print it out yourself without using all your toner, on simple things you can do at home. And so hopefully this is like how to have a low EMF computer, because I know that, you got to get your adapter, things you can do in your home to reduce the blue light and so forth. And we also have the Maryland State Children's Environmental Health and Protection Advisory Council. That is an expert organization of the state, with the Department of the Environment, of Health, and pediatricians and experts in the state of Maryland. It has guidelines on how to reduce electromagnetic field radiation, and you can download that. It has all kinds of ways to reduce exposure at home. And then we also have...
I just wanted to congratulate you on that and the incredible work that you've done in Maryland with your other colleagues there, because it is quite a challenge to get a state-level health authority to tune into this issue. I know I wrote EMF fact sheets with the Massachusetts Department of Public Health back in 2016, and they have never been released to the public. So I know politics gets in there. And we want to encourage people to take these resources that you've worked so hard to get put together and share them with their own state, with their own agencies, and say, look, you don't have to be the first to stick your neck out on this controversial issue because they get pressure by industry. Look what Maryland already did. So please use these resources that Theodora has so beautifully pulled together for us all to use with our own state, our own towns, our own communities, our schools, and our families and friends.
Yes, as much as it seems like, why am I carrying around all these papers? It really is nice to have, when you meet with your representatives and officials, to show they won't be the first. This has already been done. We have Dr. Joel Moskowitz at the University of California, Berkeley, Public Health. We have his two-pager. We have a two-pager from Environmental Working Group, which has all kinds of fabulous resources on how to reduce exposure to pesticides in your vegetables and fruits, and dealing with other toxic chemicals in your beauty supplies. But they also address wireless radiation, a fact sheet there. We also have the greenvessels.org infographics on reducing exposure, and the California Department of Public Health recommendations on cell phones and how to reduce exposure to cell phones. So this is just a nice, hopefully easy to understand website that has all kinds of simple steps, more in-depth steps on reducing exposure. And I do have a second page, which I want to show you, which is tech tips. Okay. So here we talk about, what does emit radiation in your home, your router, your baby monitor, Echo, these little smart speakers, video games, and things like that, your phone, and then easy things you can do with each thing mentioned. There's how you can reduce exposures to cell phones, a couple tips. In the car, smart meters, speakers, baby monitors, wearables, routers, home phone, laptops, computers. We try to have so you can say, okay, what do I do with my computer? So one thing at a time. So hopefully that's helpful. And then I just want to make sure that our website, environmentalhealthtrust.org, you can go to also get more information. We have information on, I like to point this out to people who are new because I love films and movies. And we have some films that you can screen at your library like Cece does. And you can watch just to learn about this issue. Oh, I forgot to show you one important thing, which is our campaigns. Okay.
We have about 1 minute left, Theodora.
Okay.
I know you have so many incredible resources, and I love that you're organizing it in a way that is so simple with the science, the risk, and so straightforward right to the solutions. And we know it's overwhelming, but if people can just take baby steps, just go to the one or two things on Theodora's website that intrigue you right now, take care of that, and then come back another day and start taking more steps towards safe technology. So
yes, and wait one second. Please sign up for our newsletter.
Okay.
Please. That's really important. And join our campaign. We have action alerts. Get on our list. We will update you with what's going on. And also with our action alerts, you can write your representative. Everything's already pre-done. You can edit it if you want. Thank you.
Excellent. Theodora, thank you for your time. We're so grateful for everything you and your colleagues do at Environmental Health Trust, and we look forward to what's to come. All the best, everybody. Have a tech-safe day.
Thank you.